Good morning, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And we're winding down our day 3 of the event, and I'm so pleased to have in the studio two people. First, Stan Nowak, CEO and co-founder of Silverlink Communications, and his colleague, David Veroff, Senior VP of Analytics at Silverlink. Thank you so much, gentlemen, for joining us today.
Thank you, Mabel.
Well, first of all, Stan, could you please give us an overview of some of the trends that you've seen in consumer engagement and why that's important to know in the marketplace?
Well, I think it's interesting today, and I actually perceive that we're moving past consumer engagement to customer experience, right? So we have traditionally been very focused on episodically engaging a member to do a specific thing. And now, honestly, there are so many people that are so interested in getting the consumer to do different things, right? Your doctor now is financially incented to get you to behave the right way, and your hospital is incented, and your payer organization is incented. So there are so many people that are trying to motivate behaviors of the consumer that what we're seeing, I think, today is customers really redefining the way they think about that consumer and starting to talk in terms like customer experience that was really rare just a few short years ago. And that's allowing us, I mean, at Silverlink, we've been doing a lot of this episodic engagement work across the spectrum of all things that require consumer behavior. But today we're starting to look from the consumer's point of view out at the various people, and then sort of looking at how does it look holistically from the patient or member's perspective. And that's teaching us a lot about what the ecosystem needs to do better and how you can motivate a consumer in a much more efficient, smart, coherent, cohesive way.
And it sounds like the consumer is paying attention and has a variety of different ways he can react to the information, right? So how do you ensure that you're getting the right response from people?
Yeah, and I think, we've traditionally used a series of strategies, including analytics. One of the things that David leads for us is the analytics group, which basically does a lot of testing and champion-challenger testing about different interventions, then measuring how effective those interventions are with consumers.
Okay.
So you have to think of consumers as different types of consumers. Timing is extremely important. When you ask them to do something and present them with information is critically important. And then how you deliver that message. What channels of communication do you use? How do you word it? What vocabulary do you use? And those kinds of things. All of them are very important, and we're learning continually.
Well, yes, and through your learning, you've come up with some data, David, to really say that getting this right really matters because it impacts return on investment.
Absolutely. I mean, we've spent a long time talking to our customers who've done a very good job of thinking through the business case for specific activities. But now we tried to answer this big question: what's the total potential value of engaging an individual? And so we took a look at all this data, all the information we could pull together through the research community, and also engaging thought leaders in the community, talking with our customers quite a bit to try to assess the full value of engagement. And what we did is we took the point of view of a commercial health plan, a 1 million member commercial health plan.
Okay.
We tried to think about what it would do if we could get 10% of that population fully engaged. And we discovered that when you add up all the potential value for the health plan, you can get up to about $100 million in value.
And that's just from getting 10%?
Get 10% more.
Just 10% more fully engaged, and it will add up to that big number.
Yeah, exactly.
Which would about double the
huge.
profit of a health plan of that size.
Right, and a lot of that is driven by improvements in the cost of healthcare, but also better retaining the customers and also improving administrative costs for it.
Do we have a clearer idea yet of how to retain people's attention and their loyalty?
I think the answer is no. As an industry, I think the sands are shifting under everyone's feet right now. It's really interesting to see how how consumers are shopping, whether they're price shopping, whether as we think about. I would say there's a fairly good idea in Medicare populations and in commercial populations. In this emergent area of exchange populations, it's very different. And I think we're still very much in the learning phases of what it will take to retain populations in that space. But our view is that pricing is going to be taken off the table as a factor because the bans are compressing pricing. Product is really going to be about network, so your network's going to differentiate your health plan. Consumer experience is one of those things that's going to be highly differentiable in the marketplace. So you can actually, that's one of the levers that health plans have, is their consumer experience. And there aren't that many levers left, right? You can't select risk, you can't price, you can't have a wide range of products. You can invest in your brand, you can define different networks, and then you can focus on customer experience. And that's why I think you see companies like Oscar very much focused on customer experience and how that customer experiences their service. It is one of the few things left that you can change.
Right, right. David, do you think that organizations are aware of the kinds of data that you have put together? Are they doing their homework on what needs to be done and how important it is to do the homework?
I think they are on specific business cases. I think that what we were trying to do is to elevate the conversation to the enterprise level, to think through what the total business case is around engagement. And by doing that, I think people can better translate that to priorities. So the problem that I think a lot of health plans and others of our customers have is defining what to do for each person, what's the value for each person, what's the value to the enterprise, and thinking about that holistically is actually critical in that question.
Right. We've had a chance to talk a couple of years in a row now, Stan, and each time you have grown in your understanding of what the next phase is. Where do you go from here?
So I think the answer, and it ties back to David's analysis of what does this mean enterprise-wide, is really helping our clients navigate from where they are to where they know they need to be. There's broad recognition that there's tremendous value in changing consumer behavior. But this was the first time it was quantified for folks, and we can really make it tangible for them. There's broad recognition that they don't want to be just a claims administrator generally. They want to play a role, they want to be a trusted guide for consumers. And there's broad recognition that they're not there now. So the question, what we're doing with clients is helping them define the steps to go from where they are today to a consumer-focused organization. And part of that is just organizing what they're doing and creating a lens through which to view the consumer experience that they're delivering today. Then it's about rationalizing that and controlling that experience and defining a different experience for you. So Mabel's getting information at the right time, in the right way, to help her make some critical choices that are in front of her. And that's we're very early in that process, but that's the next step for us as we sort of mirror what our customers' priorities are.
Well, thanks for bringing me up specifically, because I would define myself as a very cynical consumer, and I do hang up a lot on the messages that I get at very inconvenient times of the day. Can I be swayed somehow? You're looking into that, right?
We're looking into you specifically. No, I would say the best way I think about is to make sure we don't, make sure the information you get is controlled. So in other words, we don't just talk to you about what we want to talk to you about. And as I say that, I'm speaking on behalf of the industry.
Yes.
It's not about us. It's about what are the decisions Mabel's making and what is the specific, personal, relevant, timely information that she needs to make decisions. When you're in the airport and you get a text about your airline, you pay attention to it. It's relevant, it's timely, it's giving you information you need, right? Healthcare can get there. Right now, there's a control issue that the industry has, that they're telling you what they either need to tell you or want to tell you. They're not really thinking about what you want to consume at that point. So I think there's an issue of self-control that the industry needs to move toward. Okay. And that will help you pay attention, because you'll start to get that same training that it's relevant and important.
I think an additional thing is we also need to understand how you want to be communicated with. I mean, people don't all want to receive phone calls at 6:30 in the evening, and they may actually prefer to get an email or SMS message.
Yes. Now, Stan, you just moderated a panel that you seem very excited about, and you learned a lot yourself. So tell me, what was the takeaway that you got from that experience moderating?
Well, what was interesting, we had, we had Oscar, sort of a new age health plan. We had Johns Hopkins, an academic medical center of the highest reputation in the country. We had Disney. We had Rite Aid, also Health Dialogue, and Ready Clinic. So retail clinics and big provider organizations. So the interesting thing, I think, was the interaction between various large, respected constituencies in the marketplace, a new entrant to the marketplace, and how they're sort of shaking up the model. And so that interaction was very interesting. And Disney is stepping forward, being a more aggressive manager of health for their cast members. At the same time, other employers are stepping back. So listening to sort of the dynamics between the various constituencies and how they're thinking about the consumer was very interesting, because it is there are lots of people competing for the consumer's attention, and they all have different strengths, they have different challenges, and they have now, they're all rethinking their strategies. So that was, I thought that was what made it interesting for me as a moderator.
Absolutely, it does sound fascinating. And your message for attendees here at the conference this year, Stan?
I think they should download the podcast of that session. It was extremely important, probably the most important information, I don't know, since Declaration of Independence. Something is very,
wow.
Yeah, okay. Perhaps. Something like in there, the invention of the printing press would be another, and then that podcast really would be wonderful.
Okay, well, we're going to have to leave it there, Stan. Thank you, but a great way to leave it. Thank you. And I'm Mabel Jong. Thank you so much for watching.
Thank you, Mabel.
Thank you.